People suffering from any type of liver disease, how can they take care during summer? Let's understand that in today's video. In summer, feeling thirsty, tired or dizzy may seem normal. But for liver patients, these can be early warning signs of worsening condition. Because in hot weather, the body loses water and electrolytes very quickly. And if your liver is already weak and diseased, even a small imbalance can directly affect the liver. That is why whether it's a fatty liver disease, chronic liver disease, end-stage liver disease, hepatitis B, hepatitis C, hepatitis D, hepatitis E, liver failure or liver cancer or liver cirrhosis, managing your body's condition properly during summer is extremely important. First, let's focus on hydration. When the body is dehydrated, blood flow and toxin clearance from liver and kidneys get affected, which can increase fatigue, dizziness and weakness. But not managed properly, it can lead to fatality. But here is an important point. If you have liver cirrhosis with fluid accumulation or ascites, then drinking excess water is harmful. Fluid intake must be appropriate and balanced. Your fluid intake must be equal with your urine output. Now, let's talk about diet. Heavy, oily and spicy food puts extra load on the liver and increases internal heat. Instead, you can take light, easily digestible and fresh food that supports liver function and reduces stress on the liver. Accurate salt intake is very important in liver patients. Salt intake in the diet should be limited to 3 grams per day. Next, heat exposure. Spending long hours in direct sunlight can cause dehydration. Patients with ascites can take protein intake up to 60 to 80 grams or more per day as per their need. Less protein in diet can cause excess ascites. Patients who are taking non-vegetarian food can take fish and eggs. These are easily digestible proteins. Patients who can take only vegetarian food can take vegetarian proteins like pulses or soya bean and protein supplements. Spending long hours in direct sunlight can cause dehydration and mineral imbalance, blood pressure fluctuations and metabolic stress, which can be risky for liver patients. So, avoid going out in peak afternoon hours and keep your body cool and stable. Another critical factor is infection. In liver disease, immunity is often low, and in summer, contaminated food and water can increase risk of infection. And one of the biggest mistakes is stopping treatment as soon as patient feels better. Liver diseases continue to progress internally, so taking medicines on time and continuing suggested treatment is extremely important. At modern homeopathy, we have oftenly observed that within 2 to 3 months of starting treatment, patients begin to feel better, symptoms reduce, report shows improvement, and patient feels that they are completely recovered. Patient stops the treatment on their own. But this is where the biggest mistake happens. Stopping treatment midway can worsen the condition again. That is why one of the most important things, treatment should always be taken as per modern homeopathy's standard medical guidelines. Modern homeopathy's unique treatment has been personally researched and developed by me. It is a scientifically developed and proven treatment system. Over the past 30 years, at modern homeopathy, successfully treated more than 2,15,000 critically ill patients. Our single objective is to provide safe and effective treatment for liver disease that can help the patients to live disease-free life.